That? Yep, ureter. What's this gigantic thing? Okay, he's got a weird giant bladder. And then this is his, and it is huge also. Okay, that's a fat urethra. Little tiny penis. Okay. All right, so let's go. Well, here, let's chop one open. See what we got. That interesting? It's like, ooh.
Oh no, this coffee smells good.
Does it?
Yeah.
It's probably gonna give me a heart attack because it's not decaf. Okay, you can't see a whole lot in cat kidneys because they're so small, but at least we can see the different colors of the regions. Okay, so you see around the actual perimeter here, that is called the cortex, and the darker area is called the medulla. Okay. Let's see if I can try to get some things here. See a little bit of the structures. Not really. Okay. Here's a renal sinus. These are calyces, but you can't see the detail of it. Okay, but it's pretty good for the outer layer is the cortex, and the inside is the medulla. And this is called the renal capsule. It's like just like the thing that goes around the heart. Okay, renal capsule. And kidneys are called primarily retroperitoneal. What does that even mean?
It's behind the body wall.
It develops behind the body wall. If it's secondarily retroperitoneal, it developed inside and went behind. This one is primarily retroperitoneal, which means it develops behind there. Okay? It never was on the inside. It's always been on the outside. Okay? This is why it's so dangerous for people to remove that lower rib. There's just you got a small fat pad that it sits in, and then a little bit of a muscular wall and like one rib that helps protect part of the kidney. So don't get your ribs removed.
Protects the diffuse dorsi?
No, it's basically a rector staining group, sort of. A little bit of the lats. Let's see how far down does that really come. Yeah. And then one little rib in there, and a small fat pad. Really small fat pad. Oh, I meant to show my other students. I have something really cool to show you. What part of the kidney is this? Cortex. And what part of the kidney is this? Medulla. What is that? Pyramid. And at the tips of pyramids, we've got papillae squirting into these things. Minor calyces. This is a major calyx, and those drip into the renal pelvis and go down the ureter. Okay, that's about it. What is that? Adrenal gland. What's the name of the blood vessel that supplies this? Suprarenal artery. And then this one is? Suprarenal vein. What are these? Well, here. Purple. Blue. Renal veins. Red. Pink is? Renal artery. Remember? That's pretty much it for today's stuff on her. What was that?
It doesn't look like a girl. Her face.
I know, and all our bits are out, so you can't really tell much. All right, what do we got? Not much. What's that?
Suprarenal artery.
Suprarenal artery.
Suprarenal vein. Renal vein. Renal artery. Adrenal gland. Kidney. Ureter.
Okay. How do you know? There's a prostate gland and seminal vesicles. Okay. What is this? Adrenal gland. Where's my model that shows you? Oh, it's right here. So what area is this? What are these little things? I didn't tell you the names yet. It's arcuate arteries and veins. They arc around. What is the tip here? Papillae, what is this? Terrible looking pyramid. What part of the nephron makes up the pyramid?
Wait, no,
The conducting
Collecting ducts. What's in between here?
columns.
A column. What part of the nephron makes up a column? Loop of Henle. Good. What is this? Major calyx here. Renal pelvis. This goes down. Okay, and then you've got something called the trigone inside here. See that? 1, 2, 3. Okay, it makes this little triangular area. This is where the right ureter goes in. This is where the left ureter goes in. And this is the urethra. So those 3 points make up the trigone, the triangle. And in this area, if a doctor looks inside your urethra into your bladder, it happens. You have to do that sometimes. Yeah, it hurts. They can tell by the cell buildup what part of your menstrual cycle you're on, obviously for females. Isn't that weird?
In your bladder?
In your bladder. Why? Why would all that? Why would they be able, what the hell? Why? Why? Think back. Way back. For the most part. What is this? Renal vein, and under there? Artery. Remember, these two systems are linked. That's why we're even covering them together. They're embryologically linked. Okay. Nice model. What's this thing up here? But look, see how it's got 2 different colored regions? That's because there's the same thing. Yeah, cortex and medulla. And next week, we'll talk about the different hormones that are kicked out of each of those regions. Okay, some of them are spit out by the medulla, some of them are spit out by the cortex. Okay, so same thing here. We still have a cortex. And remember, the cortex isn't just right here. It wraps around, right? It's 3D. What's that? Pyramid. What's that? Okay, yeah, I would probably point to it something like that. There'll be an arrow pointing up to this if I'm going for a pathway. Okay, that makes sense? What is this? I already asked that. What's this? What part of the nephron do I find here? Loops of Henle. What do I find in here? Collecting ducts. What do I find in here? Glomerulus. Proximal and distal convoluted tubule. Okay. What is? That will be very difficult. Okay, so if I was going to pin a minor calyx as opposed to an arrow going here, I would have a little sticker right here. Okay. And this is going to be the easiest model to do it on because it's the largest. A major calyx, I would put a sticker here. Okay. And for a sinus, I would put it like right there. Or any of the other models are better for a sinus. Where are the other kids? Oops, sorry. Thank you. So a sinus would be like right here. And ureter, I would be having it hanging way down here so that you know I'm not talking about the sinus. I'm not sinus, pelvis. Okay? The sinus, any sinus, is like an empty, cavernous area, right? So the renal sinus is actually all right here. The artery and nerves, the artery and vein and the ureter all dump into the sinus. Well, it's very difficult for me to pin an open space because I can't go, it's right here on the exam, right? So, yeah, sinus, it's there. I'm not overly concerned with it though. All right, so pelvis, I would put it right here. A ureter, I'd be way down here. So don't get confused. I'm going to be very clear. If I'm pointing at a tip here, I'm looking at papillae. If I'm on this, minor calyx. If I'm on this, major calyx. If I'm down here, pelvis, or even probably right here so that you didn't get messed up with the blood vessels. Probably right here, sinus. And then a ureter, I wouldn't use this one because I don't think that's clear enough. Where does the ureter start and where does the sinus end on this model? Too confusing. I'd put it somewhere down here on something like this. think. I'm not ever trying to trick you. Never, never, never am I trying to trick you on these exams. So if it feels tricky to you, close your eyes and start over. Okay, because I'm never gonna go, I don't do that. I just don't do it. Never do. Okay, it's hard enough as it is. I don't need to do that too. All right, here's a close up of a glomerulus. I've got one right here. I have still never used that on an exam. I like this one though. Okay, so I can use this area or this area. Like it. So here are our arcuate arteries and veins. This little yellow blobby, glomerulus Bowman's capsule. The yellow line, proximal convoluted tubule. This loop of Henle, white, distal convoluted tubule, and then what is this? Collecting duct. I'd pin a collecting duct way down here. Okay. I would put an arrow right here, or yeah, up here.
I like that model.
I know, isn't it interesting and weird? I know, I like it too. Not wild about that. It looks anemic. I'll just. Here's a blow up of all this. Yeah? Make sense?
Yeah.
Okay.
How do I find out it's there?
You have so much pain. A tube there, it's not really a tube though, it's a ligament holding onto the ovary, anchoring it to the uterus. What is that? Yes, it is, exactly. It's called the ovarian ligament. Okay? This one here, it's wide and broad, on a broad, it's the broad ligament. Okay? Broad ligament here. This is obviously the vaginal canal. At the end of the vaginal canal, you've got this donut looking thing. What is that? That's your cervix. So fast forward 2 months, and now you're 5 months pregnant. Floating in its own pee, it's so cute. Alright, so what is this? Vagina, or vaginal canal, yeah, at the end. Cervix. This here, right here, is called the cervical canal. Look how long it's gotten during pregnancy. Everything's starting to move into spots that it wasn't before. Okay, you're like, where did that go? I don't, okay, well, I'll find it later. Okay. Cervical canal. Uterus. Fallopian tube. Fallopian tube, yeah, things are changing. Okay, fallopian tube, what's that? Fimbriae, and that? Ovary, and this yellow line here? Ovarian ligament, okay? The broad ligament is just kind of like in here somewhere. Ooh, even further along, we're in 7 months. Okay. Now it's starting to get crazy. Vagina, cervix, cervical canal, uterus. Oh, why is that there? It's supposed to be sticking out like this. Oh, everything's weird. Fallopian tube, ovary, fimbriae, ovarian ligament. Make sense? Okay. Okay. Now, anywhere. It's a female. Okay? First thing, look for testicles. No nuts, it's a girl. Okay, fine, calm down. Now you see that it's a girl. This is a terrible model. But it'll work. Alright, so let's pick a big structure. What's this? Uterus. It's the uterus. How can you tell it's a uterus? Well, first of all, it's got a fallopian tube connected to it, and fimbriae, and an ovary there. But also, you've heard of women when they're pregnant, that the baby will stomp on the bladder and make you pee, that means the bladder has to be below you, below the embryo. Okay? So this is the bladder. Okay, well if that's the bladder, what's this line?
Urethra.
It's the urethra. Okay? What's this then? It's your vaginal canal. And then there's an area right here at the very, very opening. It's called the vaginal vestibule. You've heard of a vestibule in a church? Or your entryway in your house is called the vestibule? If you have like a nice shishi house, it's called the vestibule. None of us have a vestibule, right? I like to pretend mine is a vestibule. It's not. But opening entrance. Yeah. Okay, so you've got the vestibule in the church. Okay, is that, you know, Catholics, any Catholics? Any Catholic? Okay, you know, like right when you walk into church and then you got to go through another set of doors, you're in the vestibule, right? And then you go into the whatever area you call it. Okay, but this is the vestibule, right at the opening entrance, vaginal vestibule. Okay, you've got the lips, you've got inner and outer. The inner ones are called labia minora, and the outside ones are labia majora. Okay, labia just means lips. Okay? Labia majora, labia minora. All right, what is that? It's the clitoris. Okay? Oh, why is it so long? Because it's 2 rods of erectile tissue. It's not a little bump. It's 2 rods of erectile tissue. Just like on a penis, where we have 2 rods of erectile tissue at the top and 1 rod at the bottom. Your monkey face? That's a cross-section of a penis. Okay, 2 rods of erectile tissue. On the male, it's called corpus cavernosum. Plural is corpora cavernosa. Well, females have 2 rods. It's called corpora cavernosa clitoridis. Say it, you gotta know it. I'll probably put it on there. Okay, because I like it. Nobody can ever figure. I'm surprised she knew it was the clitoris. No one else can ever figure out that it's the clitoris, which makes me laugh. Because it doesn't look like what you would expect to look like it on a cross section, right? It's a long thing. Really weird. Corpora cavernosa clitoridis. Say it again. Corpora cavernosa clitoridis. Do it again. Corpora cavernosa clitoridis. So if I pin this and I say, what erectile tissue is this made up of? Corpora cavernosa clitoridis. Okay? Alright. What's up? It is the anus, or yep, rectum in here, anus, rectum. Either of those I would take. Okay. Alright. So, what's this? Ovary. What's this? Vibria. This one? That one? Ovarian ligament. Yeah. The one just leading from the ovary to the uterus. Okay. What is this? Vaginal vestibule. Vaginal canal. Cervix. Cervical canal. Uterus. Bladder. Urethra. Clitoris. And what erectile tissue is this derived from?
Corpora cavernosa clitoridis.
Yes, corpora cavernosa clitoridis. What's that? What's that? Labia minora. Labia majora. Another one. Any testicles?
No.
So it's a female.
Bladder. Urethra.
canal, uterus, cervix, cervical canal, labia minora,
Labia majora.
labia majora. Doesn't matter how you pronounce it. As long as you can get it on the exam, doesn't matter. By the way, what's this? It is a bone. It's your pubic bone, right? Oh, what's this thing called? It is a fat pad called the mons pubis. Mons pubis. It's for cushioning. Okay, mons pubis. What are this? What are this? Labia majora. I don't care. What's that? Anus. What's that? Fallopian tube. What's that?
Ovary.
Oh, I'm sorry. Ovary. Sorry, that was me. Ovary. This thing. Ovarian ligament. Did I do that? Clitoris. What? I don't want to say dry. What type of erectile tissue is this? Corpora cavernosa clitoris. By the way, I don't know if you noticed, but the KW.com is updated for the rest of the quarter. Would have been really helpful to have today. Tired of that one. You good? You good? All right, so look. There's a big old testicle hanging
Yeah,
out.
mine ran out of storage.
Easy to figure out, okay?
Oh my god, it's so dark.
Dark.
Oh no, it's fine.
Oh.
The light.
Okay.
Oh.
This, of course, is the one that's got, no, it doesn't go like that. That's not the natural state. It goes like that, but this one doesn't, it's this side, but that's wrong one. You. Yeah. All right. It's harder than it looks to hold that on there. Okay. So, obviously it's a male. Okay? We've got testicles here. We have a penis here. What is that?
Bladder.
Bladder. What is that?
Prostate.
Prostate gland. What is this? Oh dear.
Penis?
It's a penis.
Oh.
Yes.
Here, like
It's a penis. This
urethra.
is the urethra. Okay? Now notice that the urethra comes from the bladder. There's another little branch right there.
Prostate duct.
No, that's a very good guess. But if we back around and take a look, it's coming
Oh. The
from here. What is this thing?
Vas
It's the vas deferens that's coming up from, ooh, this whole thing is the
spermatic
spermatic cord. And then the artery, nerve, and vein are going to keep going up. The vas deferens is going to go back behind the bladder and go through the prostate gland. Okay, this is why when you have an enlarged prostate, guys have to pee nonstop in the night. You know, you've heard this and you see the commercials and like, you know, do you pee 20 times a night? You could have an enlarged prostate because you're not able to empty your entire bladder because it's got to go through the prostate, the urethra. So does the vas deferens. It goes through the prostate at the ejaculatory duct.
What's the function of a prostate?
Squirt prostatic fluid that they don't, yeah.
We don't know.
I don't know. Somebody knows, I'm sure.
All right.
It squirts prostatic fluid into the semen.
Sure, I'll take it.
And
I just wonder why
It's
like people
frequently
can't get it
enlarged.
removed.
Yeah, you wrote prostatic fluid.
yeah, prostatic. Oh, protatic. is
Oh,
what it-
protatic.
protatic fluid. It is what it's called. Prostatic fluid. Okay. I don't know. Ask Ken. He'll know. Damn, now I'm all curious.
All in the back.
All right, so ejaculatory duct going through here. What squirts into the ejaculatory duct? Seminal vesicles.
Seminal fluid.
Squirt seminal fluid. Seminal vesicles squirt seminal fluid. You're going to get seminal vesicle and seminiferous tubules messed up. Just remember, seminiferous is more fancy sounding, right? Seminiferous tubules, tubule is really fancy sounding too. They go together. Seminal vesicle. Seminiferous tubule. Okay? Tubules are obviously a bunch of tubes. That's obviously got to be the one that's in the testicle. Okay? Seminal vesicle squirts seminal fluid. Okay? Just make that like a little mantra, because those are the ones you do get screwed up. Okay? All right, then you've got two different types of erectile tissue on a male. You have corpus cavernosum, because there's cavernous, big caverns to fill with blood, and then corpus spongiosum, because it looks like a sponge. Okay. Corpus spongiosum is the one that has the urethra running through it. Well, the urethra exits the glands of the penis, or the head of the penis. Therefore, the head of the penis has to be corpus spongiosum, because that's where the urethra stays. Does that make sense?
Yes.
So the whole glands is made up of spongiosum, and then you have two rods on the top of corpus cavernosum. Okay, the cavernous bigger ones. Okay, make sense?
Yes.
That's it. This is a terrible model. This here, corpus cavernosum. This one, spongiosum. Good. What is this? Prostate gland. What's that? What is this? Urethra, and this is ejaculatory duct. And this bit right here, squirting in, it's seminal vesicles, squirting into this whole thing. Okay. Now, there's another thing here. There's a little tiny gland right here. Okay. It's called the bulbourethral gland. Bulbourethral gland. This is the bulb, which is part of the corpus spongiosum. It's going to squirt this gland. And this gland is going to squirt into here, into the urethra. It's going to squirt pre-ejaculatory fluid. Now, let's think about this. What do you do with your urethra, boys? You pee through it.
Boys.
Or girls. Let's think about pee for a minute. What's the pH of urine?
Acidic.
Is it really acidic? What's neutral? So what should your pee be? Ooh, I don't want to pee bleach. That'd be terrible. I don't want to pee. It should be 7. We want it neutral. Are most of us ever neutral? Most of us don't drink enough to be neutral. Right, but that's your target. You know, it reduces kidney stones. You want to be a 7, but more often than not, we're a little below that. Okay, so 6.5, 6.4, okay, which is still pretty acidic. Now, then I want to run a bunch of sperm through that tube that I just peed on. What is something like a 6.4 going to do to sperm?
Kill it.
It'll kill it. Okay. Well, that's not good design, right?
Yes.
She was like, yes.
No. So, this bulbourethral gland, I've got a better model somewhere around here. I haven't seen it today, though. Right here, will squirt in here pre-ejaculatory fluid, which will do 2 things. It's going to neutralize the pH in here, and it's super slimy. It's like Astroglide, natural Astroglide. It's a lubricant. It's a lubricant. And that's what's dribbling out before, way before they have an ejaculation. Okay. Now. That's it. Yeah. Okay, so this is the testicle. This is the epididymis. This whole thing together is the
Spermatic cord.
Okay. All right. great model. This one is really nice. Beautiful. So, testes, epididymis, this tube right here. No, this coming off of the epididymis is the vas deferens. The whole thing is the spermatic cord. It goes in the body at the inguinal canal. The artery, nerve, and vein are going to keep going up. The vas deferens is going to go back behind the bladder. What is this thing here that's going to meet up and squirt in here? Seminal vesicle. It's going to go through the bladder, or through the prostate gland rather, and meet up with the urethra. Okay? This is the bladder, this is the urethra, this is the ejaculatory duct. Okay? If I look on this side, here's my prostate gland, here's my ejaculatory duct, here's my urethra coming from the bladder. Okay? It's going to go whoop, out the penis. This is corpus cavernosum. This one is corpus spongiosum. This is the urethra. Good?
Yeah.
You ready?
Just in case we don't miss anything.
All right, what's this?
Superior vena cava.
Yep, this.
Brachiocephalic vein.
What's that?
Jugular vein.
Which one?
Jugular vein. Common.
Not
jugular.
Internal.
Internal.
Okay, what's this?
Subclavian vein.
If I go about like right here.
Axillary vein.
If I go way out here.
Brachial vein.
Okay, and if I was out here?
Radial or ulnar
Ulnar,
vein.
pinky.
vein. Radial vein.
I can't tell the pinky.
It says here, I'm like this.
pinky. Look, his thumb is over there.
Oh, I don't have a cat.
Yeah,
I have
they
a cat
do.
that no.
They have like a little. They have like they have like a little forepaw right here.
The small one.
Let's see.
I forgot.
Cats have thumbs.
They
Not
do.
opposing, but thumbs.
No, they have
you
a
see
first
it?
digit.
Here, I'll sit here so you can
Oh, I just got that. Got in my face. All right, what's that?
Wait, which one are you pointing at?
What do you think I'm pointing at? I'm pointing at the one I'm pointing at.
Aorta?
No.
No, yours is down there. Are you like right on top of it? Carotid? No,
Phone a friend.
Yeah, you for sure. You guys need a lifeline.
Is it from the heart, the pulmonary joint?
It still isn't.
Esophagus.
Oh Jesus!
I'm throwing it out there.
It's the brachiocephalic trunk.
Oh. Okay, good. Oh, sorry. Wow. She's like, okay, we really
Wow,
need to study.
seriously, for real, right? And then we've got 1, 2, 3. I don't care. 4. Okay, so what's this one? Ugh. Come on. Right there.
Right subclavian artery.
Right subclavian artery.
Right carotid artery.
Right
Common
carotid
carotid
artery.
Left common carotid artery. Left subclavian artery.
Okay.
Oh boy.
Still sunburned.
Left subclavian vein.
Mm-mm.
Axillary vein.
No.
It's artery.
Axillary
Artery.
Yes. And then way out here. Good thing the test isn't today for in here.
Oh gosh.
Imagine having two tests in one day.
Brachial artery. Okay. So,
Descending aorta.
sure. Aorta. What's that?
Inferior vena cava.
Azygous.
A zygous.
Vein.
Azygous vein.
Yes.
Vein.
That's inferior.
Inferior vena cava. What's the name of the vessel that supplies this organ?
Phrenic vein.
Wait, what?
C345 piece of diaphragm.
No.
What's the name of the artery that supplies this organ?
Phrenic.
Phrenic artery.
Artery.
What's the name of the vessel that drains this
Phrenic
organ?
vein.
Phrenic vein. Right. That's right.
We know. All I can think about now is that reproductive song.
What is this?
Inferior vena cava.
Still. it's
Oh
not.
no, it's aorta.
Aorta. That is the.
Yeah. Inferior vena cava.
Okay. What is that?
Renal artery.
Renal.
Oh, vein.
Renal vein.
Renal artery.
Common iliac.
There's no common iliac artery in a
left
cat.
iliac.
Oh.
Left external.
External iliac artery.
Internal iliac artery.
Iliac vein.
Let's be a little more specific, shall we?
Common.
Common iliac vein. What do we have here?
Femoral.
Yep. And what do we have back here on the pink one?
Popliteal artery.
Artery. And what do we have on the pink one here?
Femoral artery.
Good. And I can't
What's
get into
this?
there. What's that one?
That one.
Huh?
Greater
Greater
saphenous.
saphenous.
Yep, greater saphenous
That's that
vein.
Vein.
That's about it, huh? Well, unless you have some repro that you do. What's that?
Aorta.
Girder?
No.
Can't
No.
say.
And it's so skinny that I'm gonna have to do this with it when I pin it.
I have no urethra.
No,
I have
it's
no
gonadal.
idea.
Gonadal artery.
Oh, because it wasn't colored. That's why I was like.
And let's see.
What did you say that one was?
Gonadal artery. There we go. That's about what I can do on here. Let's look at some cadavers.